now I'd like to move straight on and introduce Nuala Hampson, who's here with us today. Nuala's the Pharmacy Lead and Senior Educator with the Centre for Sustainable Healthcare. And Nuala and the team, I know, have recently been successful in securing some Q community funding. So I'm really excited to have you here, Nuala. Thank you so much, and excited to hear more about the project that you've secured the funding for. So we're in your hands. We can see your slides perfectly. Thank you very much.
Lovely, great. And thank you so much, Elaine, for giving me the opportunity to come along today and share the work that we are doing. My name is Nuala Hampson. I'm Pharmacy Lead at the Centre for Sustainable Healthcare. For those of you who don't know the Centre for Sustainable Healthcare, it's a registered charity founded in 2008, and our mission is to inspire and empower people with the knowledge, skills and tools to play their part in the transformation to sustainable healthcare. So we work with health services, patients and policymakers to reduce the environmental impact of healthcare. So today I kind of wanted to run through a few things. I want, of course, to talk about our project, which, as Elaine has said, has been funded through the Q Exchange by the Health Foundation and NHS England, but also wanted to talk about some of the key work of CSH, including the principles of sustainable healthcare and sustainable quality improvement, which we will be using within our project. I will talk a little bit about our project and let you know where we're at on that, and also just wanted to outline a few examples of sustainable practice in health and social care and signpost you to our CSH networks and resources where you can find out more. First of all, though, a quick recap of where we are and why we're doing this. And I think this is really important to just remind ourselves of the need to keep pressing forward and to keep the positive work going in the face of the kind of climate and ecological crisis that we are facing, and all the sort of also the political environment that we find ourselves in. So the top stripes on here show are the biodiversity stripes, and these are represent biodiversity in the UK from the 1970s to now, with green obviously representing biodiversity, and you can see how that has decreased dramatically over the last 50 years or so. The bottom stripes are the climate stripes created by Ed Hawkins at University of Reading, representing the global average temperature starting around the mid-1800s right up until now, and you can see how the temperatures are rising. So climate change threatens everything, as we saw last week in the devastation of the Spanish floods. Ecological collapse threatens our sources of food, water and clean air, and therefore our very existence. So we know climate crisis is the greatest health threat that humanity has ever faced. There's a wide range of evidence and documentation on this now, and these are some of the documents with more information if you want to go away and read a little bit more. But just to kind of bring things home, the impact of climate change, such as flooding, cause devastation to lives, homes and businesses, but also impacts health. So flooding impacts mental health. Those people who have suffered flooding are more likely to suffer depression, anxiety and PTSD, which continues for many years after the flooding event. These sorts of events also worsen existing health inequalities, as the most vulnerable and those least able to afford it will be most significantly impacted. As you can see from the picture on the right-hand side, which is from a pharmacy in Northern Ireland last winter, these events also impact our ability to provide health and social care. If all of your medicines are water damaged, if the GP practice is flooded, if your patients can't get to you because the way is flooded, then we are unable to provide the care that patients will so desperately need. And there were some horrific pictures last week of care homes in Spain with patients in wheelchairs just sitting as the flood water sort of rose around them. Heat is also an issue, and we might not think this affects us in the UK, but in 2022 up to 3,000 people died as a result of the extreme heat that we suffered that year. The very young, the very elderly, those with long-term conditions such as heart disease and kidney disease are particularly at risk. So the elderly care home population and elderly living at home are at particularly high risk of heat stroke and death. And lack of suitable temperature control in our healthcare settings and buildings also makes it difficult, A, for staff to work, but B, for them to keep their patients comfortable and provide a good level of care to their patients in those extreme heat. Air pollution, although not caused by climate change, has the same cause as climate change, as in burning fossil fuels. And according to the Chief Medical Officer, Professor Chris Whitty, up to 40,000 deaths per year in the UK are linked to air pollution. Air pollution affects us at every stage of life, from in utero right through to old age. And unlike what some people believe, that air pollution mainly affects the respiratory system and those with conditions like asthma and COPD, which indeed it does, but it actually affects every organ in the body, because the tiny particles of air pollution which we breathe in, we can't see them or smell them, they're absorbed into the bloodstream because they're so tiny, and they travel around to every organ of the body where they cause inflammation and cell damage, and are linked to conditions such as diabetes, dementia, heart disease and stroke. In terms of air pollution, I think it's something we think we can't do a lot about, but actually we can. The main source of air pollution that most people will be exposed to in the UK is from road traffic. So many of us will be car users, so using our cars considerately when we're in the car is one way that we can reduce it, and actually reducing how often we get in the car in the first place, and opting to walk or cycle or use public transport will reduce how much we are contributing to air pollution. Air pollution is also an indoor issue, which I think we often forget about, and these infographics are from the air pollution report from Professor Chris Whitty, as I mentioned, some really useful information in there. So main sources of air pollution indoors come from cooking and heating with solid fuel, open fires and wood burning stoves, the biggest culprits in terms of worsening our air pollution indoors. So again, just making patients and our service users aware of these things, doing things like opening windows when you're cooking, avoiding houses where there are open fires, being aware of what the risks are can really help people to minimise their exposure to this. So we know that climate change is having a significant negative impact on health, and providing healthcare is actually contributing to the climate change. So we know that the NHS carbon footprint is about 5% of the overall UK carbon footprint. So the fact that we are contributing to this climate change is at odds with the pledge of all health professionals to first do no harm. And as we've seen, our ability to provide health and social care services are placed at risk by climate change. So we have a moral and a professional responsibility to address this. The NHS net zero targets are legally binding. CQC now includes environmental sustainability within its well-led criteria of the single assessment framework. So we need to be thinking in our particular roles and our day-to-day jobs, what can we be doing to minimise and reduce our negative impacts on the environment in our day-to-day work. So the project that we at CSH are undertaking is focusing on medicines waste. Now medicines account for around 25% of the entire NHS carbon footprint, so absolutely huge. But it's not just the carbon footprint which we need to be concerned about. Clearly, wasted medicines are not a good use of resources. In addition, medicines, inhalers and devices tend to be made of or packaged within complex plastics, often single-use plastics, which are not designed for reuse and are difficult to recycle. There's also the impact of pharmaceutical pollution on our waterways through both appropriate use and excretion of medicines and inappropriate disposal of medicines. A recent study revealed active pharmaceutical ingredient contamination of the rivers in all of the 10 national parks in England, with contamination found at 52 of the 54 sites tested and 31 different active pharmaceutical ingredients found. So this has an impact not just on pollution, but also antimicrobial resistance, because very often the ingredients found are antimicrobials, and this is contributing to antimicrobial resistance both in the UK and globally. So medicines which are not used have the greatest overall negative impact, as they've not been taken, so they've had no clinical benefit for patients, but they still have all the negative environmental impacts of their production and their disposal. So reducing that waste in the first place will have the greatest impact in terms of avoiding unnecessary prescribing and the associated activity around medicines in the first place. So we know that medicines waste is a huge and long-standing problem within the NHS. In care homes, approximately £50 million worth of NHS-supplied medicines are disposed of unused every year. And this data is from 2010, so it's likely to be an underestimation based on current prescribing figures. So traditionally, this problem has been framed primarily in financial terms. Less is known about the environmental and social impacts in the care home pathway. So the focus of our project is to study the system of the medicines pathway for care homes, across care homes and their prescribing GP practices and the supplying community pharmacy. We want to look at the process across those 3 sites and the organisational and cultural factors which contribute to avoidable medicines waste in the care homes pathway. And to do that, we're going to use CSH's tried and tested SusQI methodology to map existing processes and measure the environmental, social and financial impact of medicines waste, and hopefully identify opportunities for sustainable change. And in doing so, we hope to generate innovative solutions and key recommendations and education resources for the efficient and sustainable management of medicines in care homes, which we will be disseminating widely. So underpinning this work are the principles of sustainable healthcare, which you may or may not be familiar with. And this is kind of sort of the underpinning principles of all of the work that we do at CSH. And what we're aiming for is to reduce the carbon impact of healthcare, but to continue to provide high quality care. And I think often we can see that sustainable healthcare actually provides better care than current care. So the 2 primary drivers to this, first of all, we want to reduce activity. So we want to reduce the need for healthcare in the first place. So we want to promote health and we want to prevent disease, because obviously by stopping the disease from happening in the first place, by reducing the incidence of long-term conditions, by slowing down progression of disease, by reducing exacerbations, that reduces the need for healthcare activity. Patient empowerment is around engaging patients in their healthcare, making sure they're equal partners in their healthcare so that they have a say in their healthcare decisions and are engaged with those healthcare decisions. So a really good way of thinking about this, I think, is thinking about a patient who has a respiratory condition like asthma. If they know how to use their inhalers, if they've got inhalers that are appropriate for them, they know how and when to use them, they know what the triggers are and when to avoid them, they know when they need to seek help, then that person is likely to be much more better controlled, which is obviously better for the patient, but also means they produce less demand on healthcare services. They have less need, for example, for courses of antibiotics or steroids. They're less likely to have emergency admissions to hospital. So engaging patients and ensuring that they are on board and understand is really important. Lean pathways is around stripping out waste, looking at unnecessary activity and improving efficiencies. And all of those 3 are around reducing the need for activity in the first place. Then, of course, we do still need healthcare activity. So then it's thinking about reducing the impact of that activity. So where we can, choosing low carbon alternatives, and then thinking about our resource use. So that might be around energy, sort of reducing waste of energy, using renewable energy, etc. And these principles of sustainable healthcare are listed in order of importance and impact. So the most impactful thing to do is prevent disease in the first place, prevent exacerbations, reduce admissions, and then sort of moving down the list. So our project is really focusing on reducing medicines waste, which is really focusing in on that sort of lean pathways aspect of the principles of sustainable healthcare. And at CSH, when we're thinking about implementing change ideas, we use a sustainable value equation to take a broader view of the impact of any interventions which we're thinking about making. So we're thinking not only about the outcomes for the individual patients, but also for the population more broadly. So in this case, thinking about reducing medicines waste, we're hoping by doing that within the care home, within an individual care home, there will be less staff time spent sort of logging and dealing with medicines waste, which hopefully will provide more time for individual patients. On a bigger picture, looking at that, reducing medicines waste hopefully will have a positive impact in terms of reducing shortages of medicines, which is a really significant issue at the moment in the UK. So that again will have a positive benefit for the wider population beyond the care homes. We also look then not just at financial impact, which is obviously the thing that we traditionally look at, but we also think about environmental impact and also social impact. So what are the impacts on the staff, on patients, in terms of their well-being, in terms of the quality of life, in terms of the time they're spending attending health services, that sort of thing. So the sustainable value equation just gives us a broader view of the impact, the changes that we might be making, and often helps us to see benefits and impacts that we might not other have picked up if we just use traditional approaches. So we use the SusQI, Sustainable Quality Improvement Framework, which has been developed by CSH to embed sustainability into existing quality improvement frameworks. And you'll be able to see from the sort of the steps of the framework that this can be easily embedded into QI frameworks that are already in use within the health and social care setting. This is not an extra, it doesn't need to be done in addition. It can be slotted in to processes that people already use for quality improvement in health and social care. So in our project, we will be using the SusQI approach. We're going to be working collaboratively with the teams made up of key staff from each of those three sites, the care home, the GP practice and the community pharmacy. And one of the big parts of the study that we want to do is to map their processes, because the medicines pathway goes across all of those three sites. And it's really important that we understand that process from start to finish, rather than looking at it sort of individually within each of those three separate sites sort of in isolation. We want them all to come together. So we're going to be undertaking this work in 4 hubs across 3 different ICSs in England. We have 2 hubs in Somerset, we have 1 in Gloucestershire and 1 in Coventry and Warwickshire. And that's really great because it enables us to look at a range of different models in terms of types of homes. So we've got residential home, nursing home, and some units focusing on patients with dementia, and also in terms of the community pharmacy dispensing models. So we have the traditional community pharmacy, we have an independent, we have a multiple, and we also have a remote sort of online style pharmacy as well. So we're really interested to see what we find from that. So we're aiming to take a really broad view of the environmental impacts of medicine waste. In addition to estimating the carbon footprint of medicines, we're also going to look at the impact related to the medicines pathway, which will include energy and travel related to prescription ordering and delivery. And we'll be looking at the disposal of medicines and other prescribed items such as sip feeds, thickeners, topical products and dressings. In terms of exploring the social impacts of the medicines pathway in care homes, we're going to think about a range of factors. So the monthly management of medicines within the care home setting is logistically complex and time consuming, it's also a high risk process. So typically care home residents are elderly, frail and on multiple medicines. Any error in the medicines management process creates real risk of harm for the patient. The monthly cycle usually entails the care home staff ordering medicines for all of their patients. The general practice staff, including prescribers and admin staff, will then issue prescriptions, and then community pharmacy staff, including pharmacists and dispensers, will then dispense those medicines, and finally the pharmacy delivery drivers will deliver those medicines to the home. So this process can take up to 2 weeks and is repeated monthly, and any change to the medicines prescribed within that 2-week cycle can create logistical challenges, and a large proportion of staff's time, particularly in care homes, can be spent on the medicines management cycle and dealing with queries and ordering and problems. So the 3 sites, the care homes, GP practices and community pharmacies, usually tend to be physically remote from one another. They're in separate buildings and often several miles apart or more. And this adds not only to the travel, but also to the challenge of communication and flexibility of process between the 3 sites. And in addition, each of these 3 sites' workload is really high and capacity is stretched. So we expect there to be significant social aspects which perhaps have not been considered in detail before, and which we hope to address within this project sort of more broadly. Addressing the environmental impact will bring a new focus to the issue of medicines waste, and we really hope to identify solutions which will help to contribute towards the NHS net zero targets, and also enable all the sites to practice more sustainable medicines management. So we're in the early stages of the project at the moment. We've just completed our first workshops here with the sites, and the sites are now engaged in process mapping and data collection. We plan to be disseminating results and findings in summer next year, and we'll be really keen to network widely to raise awareness of any of the findings and to share the recommendations and education resources. So what I wanted to do just really quickly before I finish is to just show you some examples of sustainable healthcare, and all of these examples are in the resources section of the CSH Network's website, which I'll signpost you to at the end of the session. And these are all examples of entries from our Green Team initiative, which supports organisations to undertake sustainable quality improvement across their practice. We have loads of examples. I've tried to pick a few that are either based in or relevant to care homes, and things that could be maybe duplicated in care homes. So this example from Warwickshire was a physiotherapy team who noticed they had a really high referral rate from care homes for patients with mobility problems and falls. So instead of dealing with this sort of reactively, they decided to be proactive, and they decided to have a look and see what were the most common issues and reasons for referrals. And then they went into the home and they undertook proactive exercise programs with the patients to help them build up their mobility and their strength and their balance. And they were actually able to reduce referrals by 35%. So that had a really significant impact, both on the physiotherapy team, who were there then able to spend more time in the patients who needed it, and also for the care home staff who saved time because the patients had improved mobility and reduced injury. Obviously also really positive for the residents as well. This example is from a hospital setting, but hopefully will sort of strike a chord with those of you who maybe work in care homes or looking after patients in their own homes who take their medicines into hospital and then their medicine gets lost or waylaid. So this project in Hampshire was around ensuring that patients' own medicines stayed with them within the hospital. And it was really around educating staff so that they understood, first of all, the level of medicines waste that was going on and the impact that that could have, and then giving somebody responsibility to ensure that when a patient was moved within a hospital, that their medicines went with them. Again, they managed to save quite a significant amount of money, and really significantly, the social impact of this one was that they really increased the awareness on the ward teams of how pharmacy works and the issues of medicines waste, and really improve that working relationship between the two. This example is from Great Ormond Street Hospital, and this was around reusing walking aid equipment, which is a kind of a common project now across the NHS. There was a process already in existence, but people didn't know about it. So this project was really around raising awareness of that process for returning walking aids and making it easy for patients and staff to return walking aids. And they managed to increase the return rate up to 24%. This was just over 10 to 12 weeks, and they were hoping to increase that as time went on. This one from Northamptonshire is around PPE, so appropriate use of gloves and aprons, again, I think relevant to the care home setting. And again, this is around staff education, so educating staff around when PPE was appropriate to use and when not, because they knew that a lot of staff were using PPE when they didn't need to, and this is a little bit of a hangover from COVID. Lots of these projects taking place across the country at the moment, saving huge amounts of money, reducing single-use plastic, and also increasing awareness of infection control and appropriate hand hygiene, etc. So really important work going on there. And then the last one, I think, is around reducing the amount of wasted food. So again, I thought this was something that could be picked up with care homes. And this was a hospital, again, in Hampshire, where they got feedback from patients and staff around why food was being wasted and not being eaten, and made changes around the makeup of the meals, but also the portion sizes, because patients were being given sizes that were too big, and have really managed to reduce food waste, which is really significant. And just on the back of that, to make you aware, last week this report was published, The Plant-Powered Planet, Building a Healthy and Sustainable Food System, published by UK HAC, and this is policy recommendations for the government and NHS settings on food provision in healthcare settings, and that we need to be increasing the proportion of whole food, plant-based foods within the food that we provide in healthcare settings, because this is positive both for planetary health, but much more importantly for individual human health, reducing the risk of things like obesity, diabetes and heart disease. So well worth a read if you haven't come across that. So just in terms of signposting to our resources, there's a couple of QR codes here. So this is our SusQI website, where you can see a step-by-step guide to our SusQI framework, and also see all of the other offerings that we have in relating to supporting sustainable quality improvement. I mentioned our networks website, and again, the QR code will take you to that. We have over 30 networks now, so you can sign up to these free and join whichever of the networks are most relevant to you. The resources section of this website is where you will find all of those SusQI projects that I've gone through, and many, many more. So really recommend that you go and have a look at those networks and join up. There's a huge community of really engaged, positive, hardworking people who are doing amazing stuff, so you can kind of tap into that and share with that. So thank you very much for your time. Just some email addresses there if you want to get in touch. Would be really love to hear from you. Thank you.
Nuala, thank you so much. That's so much information you've shared with us there. That's absolutely fantastic. So I'm sure we'll need to relook at that presentation again and have a look at some of those resources. Your project sounds fantastic. It's really important now we know that £50 million of care home medicines that are wasted. So good luck. I hope it goes really well, and we'll be keen to hear more from you as that work progresses. What I took from what you were saying, Nuala, and what was really helpful for us is that crossover in practice, and those examples you gave us at the end were really helpful to see that in health and care we are as one. We need to do these things as one really integrated service. So I would encourage people to look at the Centre for Sustainable Healthcare website. As you can see, lots of things Nuala's talked about are equally applicable over other care settings. So thank you, Nuala, again. We're delighted to have you, and thank you for staying with us if you can on the line. Thank you very much. And
Thank you.
I'll move on now, if I may, to our final speaker